How to care for the mental health of seniors with Alzheimer's disease. Caring for someone with Alzheimer's disease can be a deeply rewarding yet emotionally challenging experience. Alzheimer's is a progressive neurodegenerative condition that primarily affects memory, thinking, and behavior. As the disease advances, it becomes more difficult for seniors to manage daily tasks and maintain independence. Alongside these cognitive challenges, Alzheimer's also significantly impacts mental health, often leading to depression, anxiety, agitation, and emotional distress. Understanding how to care for the mental health of seniors with Alzheimer's is crucial in providing holistic care that supports their emotional and psychological well-being. While Alzheimer's disease itself is unpreventable and incurable, caregivers can play an essential role in improving the quality of life for individuals living with the condition. A thoughtful, compassionate approach that focuses on mental and emotional well-being can make a profound difference. In this article, we'll explore practical strategies to help caregivers support the mental health of seniors with Alzheimer's, ensuring they maintain dignity, comfort, and a sense of connection throughout their journey. 1. Understanding the emotional impact of Alzheimer's disease. Alzheimer's disease is not just about memory loss, it also has a profound emotional impact on those living with the condition. As individuals lose their ability to remember names, places, and events, they may experience feelings of frustration, confusion, and isolation. Additionally, the progressive nature of the disease means that these feelings may intensify over time, leading to emotional distress, agitation, and even depression. One of the most common emotional symptoms of Alzheimer's is anxiety. As the disease progresses, seniors may feel increasingly anxious about their ability to function independently, make decisions, or remember important details. This anxiety can manifest in behaviors such as restlessness, repetitive questioning, or withdrawal from social interactions. Depression is another common challenge for seniors with Alzheimer's. Feeling lost or unsure of their surroundings, as well as recognizing their own cognitive decline, can lead to sadness and hopelessness. Seniors with Alzheimer's often struggle to express their emotions verbally, which can result in increased frustration and emotional outbursts. Agitation and irritability are also prevalent in Alzheimer's patients. As they lose the ability to communicate their needs or understand their environment, they may become agitated or upset, sometimes without a clear trigger. This agitation can manifest as physical restlessness, pacing, or verbal outbursts. 2. Creating a safe and comfortable environment. A crucial aspect of supporting the mental health of seniors with Alzheimer's is creating a safe and comfortable environment. Alzheimer's patients are often disoriented and may struggle to recognize familiar places, people, and objects. This confusion can be a significant source of anxiety and fear. Therefore, the environment in which they live plays a vital role in their emotional and mental well-being. 1. Minimize clutter. A cluttered or disorganized living space can contribute to confusion and anxiety. Ensure that the environment is clean, well-organized, and easy to navigate. Remove unnecessary items that could create hazards, and consider labeling common items with large, clear signs to help the person with Alzheimer's feel more secure. 2. Create a calm, soothing atmosphere. Bright lights, loud noises, or chaotic surroundings can overwhelm individuals with Alzheimer's. To create a calming environment, use soft lighting, play gentle background music, and avoid abrupt changes in routine. A calm environment helps reduce stress and can encourage moments of peacefulness and relaxation. 3. Use familiar objects. Incorporating familiar items, such as family photos, favorite blankets, or cherished mementos, can provide comfort and a sense of continuity for seniors with Alzheimer's. These objects may help them feel more at ease and connected to their past. 4. Establish routine. People with Alzheimer's thrive on routine. Consistent routines, such as regular meal times, exercise, and sleep schedules, help reduce anxiety and confusion. Predictability creates a sense of stability and security for someone dealing with cognitive decline. 3. Managing behavioral and psychological symptoms. Behavioral and psychological symptoms, BPSD, are common in Alzheimer's disease. These symptoms can include mood swings, aggression, anxiety, and depression. While medications can sometimes help manage these symptoms, non-pharmacological approaches are often the first line of defense and can be just as effective in providing relief. 1. Validate feelings rather than correcting them. When a person with Alzheimer's becomes upset or confused, it can be tempting to try to correct them or remind them of what they've forgotten. However, this can increase frustration and lead to further agitation. Instead, caregivers should practice validation. Validation is a technique in which caregivers acknowledge the emotions and feelings of the person with Alzheimer's, even if they are based on confusion or misperceptions. For example, if the individual believes they are at a different time or place, instead of correcting them, you might say, "It must feel strange to be in a place that doesn't seem familiar to you. I'm here with you." By validating their emotions, you reduce frustration and create a more empathetic connection. 2. Offer distraction and redirection. When someone with Alzheimer's becomes agitated or anxious, it can be helpful to offer a distraction or gently redirect their attention to something else. For example, if they become upset while trying to complete a task, suggest taking a short walk together or engaging in a soothing activity like listening to music or doing simple puzzles. Redirecting their focus can help diffuse the situation and ease their distress. 3. Engage in calming activities. Certain activities can help calm the nerves of someone with Alzheimer's, reducing feelings of anxiety or agitation. Activities like gentle hand massages, guided breathing exercises, or aromatherapy, using soothing scents like lavender, can promote relaxation. These calming activities not only reduce agitation but also improve overall well-being. 4. Encourage communication and expression. As Alzheimer's disease progresses, the ability to communicate effectively can become more difficult. This loss of communication can lead to frustration for both the individual with Alzheimer's and their caregivers. However, there are ways to foster communication and encourage expression, even as cognitive decline sets in. 1. Use simple language. Seniors with Alzheimer's may struggle to understand complex sentences or abstract concepts. To facilitate communication, use simple, clear language. Speak slowly and use short sentences. Be patient and give them time to respond. If they seem confused, offer prompts or rephrase your question in a more straightforward manner. 2. Nonverbal communication. Even if verbal communication becomes more challenging, nonverbal communication remains an important tool. Maintain eye contact, smile, and use gentle touch to convey warmth and affection. Nonverbal cues can help convey your message and provide emotional support without the need for words. 3. Creative expression. Encourage activities that allow the individual to express themselves creatively, even if they can no longer communicate in the way they once did. Art, music, and crafts can provide therapeutic outlets for self-expression and emotional release. For example, playing a familiar song on a piano or painting together can evoke memories and provide a sense of calm. 5. Focus on positive reinforcement and maintain dignity. As Alzheimer's disease progresses, the person affected may experience feelings of shame or embarrassment due to memory lapses or difficulty completing daily tasks. Caregivers can help preserve dignity and foster a sense of worth by using positive reinforcement and showing patience. 1. Acknowledge achievements. Even small achievements, such as completing a task independently or recalling a familiar name, should be acknowledged and celebrated. Positive reinforcement helps boost self-esteem and reduces feelings of frustration or helplessness. Simple phrases like, "You did a great job," or "I'm so proud of you for doing that," can go a long way in encouraging a positive outlook. 2. Encourage independence whenever possible. Maintaining a sense of independence is crucial for the mental health of seniors with Alzheimer's. While some tasks may require assistance, there are often many daily activities that individuals with Alzheimer's can still manage with minimal help. Allowing them to maintain control over certain aspects of their lives, such as choosing their clothes or assisting with meal preparation, can help them feel more empowered and less like a passive participant in their own care. 6. Know when to seek professional help. Caring for someone with Alzheimer's can be overwhelming, especially as the disease progresses. It's important to recognize when additional professional help is needed. Sometimes, behavioral and psychological symptoms may become more intense, and managing these challenges without help can become difficult. 1. Professional counseling. If the individual is experiencing severe depression or anxiety, seeking professional help may be necessary. A licensed therapist who specializes in Alzheimer's or geriatric care can work with both the individual and the caregiver to develop coping strategies and provide emotional support. 2. Support groups. Caregivers can benefit greatly from participating in support groups, where they can share their experiences and learn from others in similar situations. These groups provide emotional support and a sense of community, helping caregivers cope with the challenges they face. 3. Respite care. If caregiving becomes overwhelming, respite care can provide relief. Respite care services allow caregivers to take a break, while ensuring the person with Alzheimer's receives the care they need. This time off is crucial for maintaining the mental health and well-being of the caregiver, as it can be emotionally and physically draining to care for someone with Alzheimer's on a daily basis. Final thoughts. Caring for the mental health of seniors with Alzheimer's is an ongoing journey that requires patience, empathy, and flexibility. Alzheimer's disease is not just a memory disorder, it's a condition that deeply affects emotions, behavior, and overall well-being. By creating a safe, calm environment, fostering communication, encouraging self-expression, and seeking professional support when needed, caregivers can significantly improve the mental health and quality of life of those with Alzheimer's. While Alzheimer's may bring many challenges, it's important to remember that individuals living with the disease can still experience joy, connection, and dignity. By embracing these strategies and nurturing both their physical and mental health, we can help those with Alzheimer's live fuller, more meaningful lives.